I will start going. I think there's still people joining us, but it's my pleasure to introduce Penny Paucha to lead today's webinar. Penny brings a unique and important insights into how we literally think about our role in teams, our interactions, and our responses in certain situations. Penny has a master's in applied psychology and is a trained mental health counselor. And she comes to us with a decade of experience at the coalface as a member of a primary care interprofessional team. And while she was training, she developed an interest in how teams work and neuroscience, and is now an accredited coach with the Neuroleadership Institute. She subsequently started her own firm, Instincts at Work, and she has supported many healthcare organizations, primary care practices, and leaders across the health system. So she's also supported, primary care teams in developing their team and supporting their team, but also trained large coalitions of leaders in health system transformation, such as LINs and OHTs, and organizations like the Canadian Mental Health Association and the Canadian Partnership Against Cancer. Penny is also a faculty member at the Ontario College of Family Physicians and the Dorothy Wiley Health Leaders Institute at York University. Over to you, Penny.
Great. Thank you so much, Dale, for that introduction. It's wonderful to be with all of you today as we dive into putting team dynamics on the table. So I'm excited to dive into this topic with you. So let me pull that up and we'll take it from here. Okay, so power dynamics. Good. Let's get into that because I'm sure that's something everybody wants to talk about, because we talk about a lot of the external pieces, but do we talk about those other kinds of dynamics? So just a little bit about instincts at work. So our why, I think it's important to talk about the why. So as Dale mentioned, in coming from a primary care team, I got really, really interested in team performance. And so our why is really to lead leaders in evolving their thinking to drive performance in complexity. What does that mean? You're going to learn a lot more about what that means on this webinar. We really want to start to think about how do we adapt our thinking in new ways to deal with the complexities that we all face right now. And how we do it is we develop tools. We provide tools, training, and coaching based on neuroscience or evidence-based, capacity building, sustainable, collaborative. It's important to have a growth mindset in mind. And so we train people in terms of what does that mean and how does that work? How can we shift into that? How can we help teams shift into that? And then balancing results with relationships. And you're going to learn a lot more about those pieces. So, and we're happy to have been recognized by Manage HR by one of the top leadership development companies in Canada this past year. So in terms of our intention and outcome, this is one of the tools we use. We always design each of our interactions with clients with an intention. How do we want people to feel? Back to the neuroscience, keeping the brain in mind. How do we want you to feel? What I designed for you today is I'd like you to feel a sense of possibility for creating truly collaborative interprofessional teams. So I'd like you to feel a sense of possibility about that. And some of the outcomes are that we're going to learn about, or you're going to understand more about the brain and nervous system, how it responds to complexity. You're going to learn about the neurobiology of threat. You're going to learn about how to address power dynamics to achieve true collaboration, and also understanding the critical role of leadership. And I don't mean by leadership, let me just say it's not formal leadership. You can be a leader from any position that you're in. And that's really important, especially as we understand complexity and we understand actually what it takes to align people. The critical role of leadership is stepping forward as a leader to create shared purpose, to manage threat and inspire collective action. Okay, so that's what we have on the menu today. Okay, so I think this webinar sits, just want to set a little bit of context. This webinar sits in sort of a bridge between your last webinar on competencies and then the next one on negotiation. But what I think is so critical as we dive into the 4 quadrants of change here is to think about the real drivers of behavior. What does the neuroscience tell us about what really drives behavior? Because I think unless we get real about that and we actually develop our capacities to work with that, our chances of sustaining change are very, very limited. So when we think about these 4 quadrants of change, we think about individual level. We have the individual internal, which is what we each bring to a situation. We bring our psychological, spiritual, cognitive, our beliefs, our values, our ways of working. When it comes to interprofessional care, what also comes is your wiring as a professional, right? How you think about your attitude towards someone seeking care, how you have been trained to think about the caregiver, provider, person seeking care. I'm not sure what word you feel you prefer. Let's say client in some senses, patient, even in our language, right? Even the language reveals to us something about the dynamics, about how the internal is relating to the external, okay? So we have that comes to the table. Then we have the individual external. So there's external in terms of our skills, behavior, and peak performance and how that is influenced, right? So by our internal, then the kinds of skills. So if you view the patient or the client or a person seeking care in a particular way, you may have a different stance in how you operate and how you work with that person during an encounter. Right? So the internal to the external. So that's important. Let's just kind of frame that up. Then there's also the collective internal. So when we come together as a group, when you come together, let's say with your inside of your professions, you have a collective. And if you come together within your professions, you have a collective of people who share some of your cognitive, spiritual, values-based thinking based on how they're wired, right? You see where I'm going. Some of you are nodding your head and laughing. So we have to kind of recognize that we come together in these cultures, these shared symbols, these stories in the collective internal. And we also have the collective external, okay? Organizational design, workflow, policies, procedures. I guess having trained as a mental health counselor, I've always been vastly more interested in the internal than the external. And so maybe that's where my obsession really in trying to understand these drivers has come from. But I think what we often do when we even think about competencies and negotiations, we're dealing with those things in the external realm, but it really misses, I think, in looking at that in isolation, misses the point about a lot of the internal drivers of behavior. And so that's what we're going to dive into today. So in our training program, and there was also an article that Dale and I actually, Dale wrote for us, with us, that was part of the pre-reading. I do recommend, I know it's in-depth, but it contains a lot of this. If you want to go back and if you're interested in what you hear today and you want to kind of dive deeper, it's very, very thorough. There's a lot of information in there. So I do recommend that for reading if you're interested. So our program, Evolution of Thinking, is designed around these levels. This is our performance evolution pyramid. None of this will be new to you. You'll be familiar with all of these concepts, but what we have found is that the order actually matters a great deal. And so at the base of the pyramid is vision. So clarity of vision in terms of what the leader's role, what your role is in leadership, cultivating an inspiring vision with goals and objectives. And we're going to get into why that matters. Then the center part is creating an approach culture. This is where we're going to start to address issues of trust, power, barriers to action, and improving the understanding of how we all work together, okay? Always the key word. People ask me all the time, come on in, we need a team session on trust, you know? I unfortunately tell people I don't do those, and I don't do them because I don't think they're effective. They're not effective because we have to form new habits in how we work. And we really stand here at Instincts, our stand is for transformation of the system. I'm not interested in taking dollars out of the system to do a feel-good session. That's not what I'm interested in. That doesn't align with our vision. So I think addressing those issues is way more nuanced and complex, which is what we're going to talk about today. However, it's possible. And then once those two pieces are in place, and I'm going to give you a case example of this later, so I will be getting back to it. a growth mindset can emerge. What does that mean? It means an environment where there's collective learning and innovation. If you've ever had an absolutely fabulous, like top-notch experience of working on a team, this is what emerged. And we know what that feels like. It's like everything's humming. We can talk about things. We can bring the hard issues out, but we're feeling really aligned. There's a sense of psychological safety, and this is what emerges. And so it's really, really critical piece in all of this. So let's dive in a little bit looking at our Cynefin framework. So I think what is really important here to talk about is the idea that we are in a period of complexity. We're in a situation where, in terms of the external world, there are a lot more variables. Now, this comes from David Snowden. I want to give you a little bit of background to this. So the idea is that any context you're in within the day, and that context can change. It doesn't mean a physical environment. It means you're in one meeting where you're in an encounter, let's say, with somebody seeking help from you. Then you might be in a team meeting. Then you might be on a webinar. All of these contexts can change during the day, okay? And when we're in a clear situation, there is linearity. What do we mean? Cause and effect. We know, for example, if we wash our hands, it'll reduce the spread of infection. That's something that's clear. If we're to use an example in the physical world, look at a bicycle. Is it clear how the bicycle works? Yes. We can see the chain, the pedals move. It's clear. It's concrete, it's clear. Anyone can look at it and understand how that works. In the complicated domain, we need expert information. So that might be in the physical world. An example is a rocket. We see rockets getting launched, but I don't know how to build one. I don't know if anyone here knows how to build one. Maybe you decided that it was easier to get into healthcare than rocket launching. I doubt it, though. It's probably harder the other way around. You're probably going to leave and do rocket science because it's easier to do that. I don't know. So in terms of complicated, there's lots of variables. There's lots of interacting variables, and we need experts who dive in, have a great deal of depth of information to be able to help us decode that. And so that's sort of a critical piece in the complicated. Now, you'll notice the band across the top. What's really important, if you take one thing away from the Cynefin, it's that on that side of the quadrants, things are knowable. They may not be knowable by me, because I have to go to an expert, or by you, but they are knowable. In the other domains, complex and chaotic, things are unknowable. What does that mean? Linearity breaks down. So, we're all sort of addressing things like air quality and wildfires and this kind of context. So we see this on a stage, very large stage, in terms of climate change. So in terms of trying to be reductionistic, you can remember there was a time where we were all like, reduce, reuse, recycle, like this is how we're going to fix things like climate, right? That's looking at kind of a clear or a simple solution to something that is incredibly nuanced and complex and feels actually quite impossible if we think about it at that level. Then we go to climate science and we get the scientists in, and they might present these complicated views of what might happen, but then they disagree, right? Do we do this? Do we do that? Can we come up with a solution for the melting polar ice caps, et cetera, et cetera? So those pieces become really complicated, but in fact, it's complex. And as leaders and as individuals, we have to think differently. What it requires of us is radically different. Then in terms of chaos, that's where things kind of break down. We saw this very early on in pandemic, when people didn't know what were the protocols. How are we going to care for people? Where are we getting the equipment? Where are the N95s? What's safe? What's not safe? The ministries sending things out, or your various ministries, or there's, notifications from public health, and they're changing minute to minute to minute, right? You do this in the morning, it's different an hour later. That was a period of chaos. And the reason for that is that we didn't have any information, and we, again, had to do different things as a result of that chaos, okay? So key point, knowable, unknowable. We have to ask ourselves what quadrant we're in, because we can't default to just what was done before. So what does this do to our brain? What does this do to our nervous system on the inside, right? We are continually trying to, as a function of survival, hold attention between safety and purpose. So in the safety, we talk about this as being a reactive mindset. Keep me safe. How can I keep myself safe in this situation? So back to that period of chaos, you see different kinds of responses. People got into complying. Okay, I'll just do the right thing. Okay, tell me what the thing is to do. I don't know. Tell me what to do now. Tell me what to do now. Tell me what to do now. Then there's protecting. There were those people, maybe some of us at times, where you just want to go into your office, shut the door and be like, I'm leaving the crazy world up there. I don't want to really deal with any of this, right? So we remove ourselves from we want to reduce the complexity by removing ourselves. Or there's controlling, right? An example of this, we had a chief of staff of one of the hospitals who, when COVID kind of hit, decided that at night he would go home and learn absolutely everything he could learn about SARS-CoV-2 and kind of study epidemiology on the side and do all of that. And infection control. So he was just perusing all the studies at night, and really got to a point, back to kind of what we see here, where he was applying a complicated frame to a complex problem, right? A lot of people went through that. And so what happened was that he burnt out. He had to leave his job. He had to blow up at somebody, because that need to control, to be the expert, to know, broke apart, right? So there's a kind of a concrete example. So then we're struggling between that and our creative mindset, which is achieve our purpose, what we're trying to do in interprofessional care. How can we relate, reveal, understand, and achieve? And the reason we have these kind of identified in certain brain areas is that when our amygdala is active, when our emotional center is active, we perceive more threat. We saw this in pandemic, where people really got into that space of seeing threat where there wasn't any. Oh, I know you're doing this. This is a control strategy, hence the proliferation of conspiracy theories, all of that stuff. It's directly related to our experience of feeling overwhelmed when linearity breaks down. Okay, so that amygdala hijack, that red brain kind of where we're having more activation in the amygdala, we're scanning and detecting a lot of threat. And so what we need to do in that situation, people get into that, we call it avoid versus approach. You remember from the pyramid, we talked about an approach state. So people get into this avoid state, and how does this show up on teams? I'm not participating in this unless this goes in this, people get entrenched, right? Or they get seeing a threat. This is threatening my status. Why do you get to make a decision when there's information lacking, right? We see that activation happening. And what actually happens is there's less quality thinking happening at the level of the prefrontal cortex, because the resources are kind of, being sent to the amygdala to scanning and dealing with threat, because that is a safety mechanism. But what we want to do is manage that. We don't just want to, we need to manage that in order to be able to think at higher levels and be creative, to do something that's more purpose-oriented. So how does this play out as we work in teams? I think it's really important when we think about, and you'll see in our article, we referenced David Rock's SCARF model, the idea that there are these drivers of social behavior. His model was actually derived from Deci and Ryan. And what I'm going to talk about here is Benita Roy's model of team action potential that looks at these drivers, these social drivers of how we get along, how we work in social groups. Because as mammals, as we evolve to work and collaborate, these social drivers became a stand-in for our physical safety. So in other words, if in, you see it in ape packs or in monkey packs, if somebody is excluded, their chances of survival are decreased, right? And so as we started to collaborate in groups, our sense of physical safety is heavily tied to our social success. And so these drivers become really, really critical. So this model is, in my estimation, really brilliant because it addresses so many of these complexities in a very simple and understandable way. It's not always simple to address them, but it helps us have a frame that's really, really useful. So let's start off with a key driver, which is autonomy. We all have a driver for autonomy, for the self. And the question is, who am I at an identity level? What's in it for me? Okay. That's a normal part. You know, we like to pretend that maybe that's not, but the truth is that that does drive our behavior. If it didn't drive our behavior in any regard, then, you know, we wouldn't really be very effective, actually, because some of it is that as we come together, we have to think about how we balance out what's in it for me. I mean, this is one of the causes really for not thinking about that sufficiently. People burn out. They keep sacrificing themselves and they get to a place where that balance is off, and then they become physically ill and then are removed from, right? They can't participate in the team or in the collective. Then we have relationship. Who are we and what matters most to us? So this is a critical piece around the relationality. So as we come together in interprofessional teams, who are we? What are we trying to do? What matters to us? What's our frame for relationality? Remember back to the quadrants? Is it, this is what we physiotherapists think. This is what we nurse practitioners think. This is what we massage therapists think. Is that your sort of frame of relationality because it matches in terms of your internal views and values? Or is it interprofessionally with a bunch of folks, professionals that have very different approaches and different views and different values? Okay, so there's the relationality. Then we have agency. Agency is really our ability to act, to do things, to get things done in the world. And so the key questions are, where is this going and why does it matter? And so think about these as 3 points that we have kind of a sliding scale between, okay? So sometimes, and I see this a lot in healthcare, particularly in mental health, we get stuck in relationality. We get stuck in, we all have to agree. We all have to have consensus. We all have to think about things in a particular way. And we can get really stuck in that realm of relationality. And that has, as you well know, costs in terms of agency. How do we include everybody? But how does that impact our sense of agency, our ability to get things done? You know, the old African proverb about to go fast, go alone, to go far, go together. Right. So there's an expediency that we sacrifice in including everybody. But we often have, I would say, an unexamined default that including everybody and getting to agreement is the right way to be. I would say it's neither right nor wrong, but you have to be aware that in doing that, you're sacrificing agency, right? With autonomy, people get stuck in, what's my role? What's my identity? Back to the competencies. What's my value? What am I providing here? What do we do that's valuable? People get stuck in that. And so we start getting these different dynamics that play out as we get too focused on the other pieces. In agency, if we get stuck in agency, it's like do, get this done, but we're not really thinking about the higher purpose of it, right? We're just getting it done. Next encounter, do this. Have to deal with the treadmill, but we're not really connecting it at a higher level. And so when we think about the relationship between these 3 points, we see these different, think about it as kind of that sliding scale effect, right? So how we hold the tension between autonomy and relationality is part of our trust, how we establish trust, okay? So if you're in a team and people make a break for it with autonomy and they just say, forget this, I'm just doing my own thing, what does that do to trust, right? But correspondingly, if we focus heavily on consensus building and relationality, and it affects our agency, that also has an impact, right? So where we slide on these things, and this is continually changing, this isn't fixed. So one of the problems I have with memorandums of understanding, it's, to me, a simple solution or a clear solution to a complex problem. If we just say we're going to do these things and we have these agreements, we're going to fix this. It can't be fixed. It changes based on how somebody showed up that day and what they did and how they responded to the team and whether they were in a bad mood and started yelling or accused somebody of something. These are continual complex variables. Then across the bottom, we have between relationship and agency, the power dynamic. Really, the driver here is we can make this a better world. We can make this a better world that we're going to. So we want to do that together. But our relationality is affected by our sense of agency. So let's use this as an example, which we see a lot in interprofessional teams. And I think this is important to talk about, is that physicians, back to the individual internal and how they're trained, are trained more around autonomy and agency, and their relationality is to their patients. And the reason for that is based on their training, or historically their training, is that they're trained in scientific model, kind of, push out or be skeptical of other viewpoints, challenge other viewpoints, right? Go to the evidence, but you're the one that's responsible. Okay. So think about the impact of that individual internal. And what I see on interprofessional teams a lot is the power dynamic. You're not sharing the power. Why do the physicians and right? But we're not thinking about that wiring around the autonomy and agency. And so without thinking about the relationality, right? They're like, oh, actually I see this as funny, but I see it in teachers too. Teachers are like, why do we all have to get together and talk? I'm just dealing with my classroom, because it reduces the complexity and allows them to act. And they're in a situation where I have to take action with this. Now, of course, we know, and the evidence is very clear, that we have better outcomes when we work in an interprofessional way. Patient outcomes, client outcomes, people seeking care, their outcomes are much improved. And so this is the basis where we have to think about and start to challenge these pieces. So in terms of the autonomy to agency, there's this action potential. Let's do it. So the more we include people in relationality, the more it can increase our threshold to action. It takes longer, right? So all of these things have to be discussed and on the table for us to start to work through them. Okay. And so we're just going to get into some strategies to start to think about that. But right now I wanted to ask you a little reflection question. So I want you to think of a situation in the interprofessional team, maybe where you're working, where issues of power show up. What impact does that have on relationality and on agency, in your ability to get things done and on the relatedness? And then how does that impact trust? Just take a minute and think about your scenario so that you can make it real in your own mind. So I'll just give you a minute and you can take a reflection break. And if you have any comments, feel free to put them in the chat. Okay, so how do we address this? Most importantly, it's like, okay, great, you've explained some of those things, but what do we do? How do we deal with this? There are key pieces that link back to the performance evolution pyramid. They're actually really critical to this. So to address issues of trust, we have to focus on the vision. Why? Because that balances the relatedness part with the autonomy. And so when we focus on vision, and we're going to dive a little deeper into that, we're able to balance out those needs. How do we address power? Remember, power is relationality and agency, getting things done, but doing it together. So when we create safe to fail opportunities where we're all learning together, we have the experience of doing things. We have the experience of doing things, hopefully, if you design it right, successfully. Where even safe to fail is like, even if it doesn't work, it's a great learning opportunity. This is part of how cultivating that growth mindset. But what's important here is that by doing that, even in smaller groups inside of the larger group, you have an experience together of doing something, of being in the action mode. What's really important to understand from a brain-based perspective is if we don't have certainty and clarity, there's a region of the brain called the mediodorsal thalamus that actually is like a bridge point between the amygdala and the PFC, the prefrontal cortex. Actually, more beyond just the amygdala, other areas as well. But it's constantly surveying and thinking about how reliable is this information and putting the brakes on whether or not we take action. So let's go back into complexity. As we're in complexity and there's so many unknowns, what happens in the brain? Braking system. And then people look back to what's, what do the experts say? But when we're doing things in ways that haven't been done before, we don't have that to rely on. So we need to build these opportunities to release the brakes so that we can take action, so we can learn as we do to address those power imbalances. And then to address action, bringing clarity. Train people to take a larger perspective and try to focus on that longer term collective benefit. As we work together, we can produce these kinds of results. Maybe it slows us down a little bit, but let's reference this project, how well this project went when we did it in an interprofessional way. This collaboration produced these results. We know these outcomes work. So it's back to how we address each of these pieces. So I'd like to dive in a little bit because vision is so critical, back to being the base of our pyramid, tools to align to vision. So I want to take you through that a little bit. One of the tools that we adapted from David Rock is the Choose Your Focus tool. The idea behind this is that we have, back to the individual internal and how this relates to the collective internal, that we have 5 levels of thinking, okay? They're not right or wrong. They're just 5 of them that have been categorized here. I'm sure you could come up with other categories, but for the sake of this, in terms of our focus. So we can think about things at the level of vision, planning, detail, problem, and drama. Drama, you can imagine as we go down, further down, what brain region gets more and more involved, right? More amygdala is happening the further down. And actually what's really important about that from a research standpoint is that the more activated we are in our thinking with the amygdala, the fewer innovative kinds of thoughts we have. We tend to be very routinized and go over the same old thing the further down we go. So there's less insight available, less new ways of thinking as we move down. Now just reflect on meeting that you were in the last week or so. Where did you spend most of your time in that meeting? What level of thinking was it at? You can show me with your fingers if you want. 1, 2, 3, 4, 5. All 5. Good. That's healthy. That's good if you're kind of able to scale between them, right? Most people will say, oh, we generally talk about details about the problem. And if you're a provider, that's generally what you're, back to the wiring in terms of your professional work, that's what you're wired to do. You're actually wired to think about, let me get all the details. I want to understand your history, what's going on, blah, 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 what's the problem? And then we can come up to a plan. And that's like the kind of super Trans-Canada highway of your brain, right? Vroom, vroom, vroom. It's fast, 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 super wired. That's just automatic. But what's really useful in this tool is being able to think about, hey, wait, let's time this out. What level of thinking do we need to be at here? How can we think about the problem, for example, at the level of vision? So we can still think about the problem, but we think about it at a different level. So we may say, we have a problem here in terms of, some of the tensions on the team. So if we wanted to work in a way that was more with more equity, what would be different? So when we are working in a way that's more equitable, what would that look like? That's dealing with the problem, but asking the question at the level of vision. Versus being in conclusion about, well, the physicians and they're always blah, blah, blah. And this is all, that like that whole dynamic where that story is really just a narrative that we circle on and really kind of in a way fixes back to the tap, fixes those perspectives. Okay. So you can use this for yourself. You can use it in your team. You don't have to, I know you all like to have all the background, understand all the nuances. There's not a lot to understand. I've used this in meetings where I've walked in and literally groups have used it on the spot and said, hey, I think we're getting down in the drama here. Let's just pop up. And it's a way that people are able to very simply move up into self-reflection, which of course is a really important part of leadership and getting anything done back to the agency. Okay. So that's choose your focus. And so back to the vision, I think what's important here, and you'll know many of you, I'm sure, have watched the Simon Sinek TED Talk, Great Leaders Start With Why. The whole idea about the why is that it forms, like I said, an ability to balance between the relationality and the autonomy. But the why really comes from the amygdala. It's the emotional center of the brain. If the why is not inspiring enough, why would I give up my autonomy, who I am, my identity, my perceived power, my ability to get things done? Why would I give that up? You're not giving me a good enough reason. Why? Because there's a protocol that says we should do it? Because there's a memorandum of understanding? Like, why do I care? I don't. It's not compelling enough. Because decisions are not made, I'm sure you all know this, but we like to fool ourselves, not made with the rational part of our brain. They're made at the emotional level. And so we just come up with reasons and justifications for what, advertisers understand this all very well. It'd be a good idea for us to take a lesson from that. That understanding those emotional drivers are really, really critical. So starting with the why and then the how, what. How do we want to do it? Yes. What? But why are we doing this? And so the idea of connecting to purpose is that, we use this visual to talk about how a vision creates alignment. It provides the whole context for why are we doing this and why are we here? And we forget it because back to the, purpose side, we're too busy letting the amygdala run the show around the safety piece, and we forget. When I do this with teams and I say, okay, tell me your vision statement, they're like, oh, I think we had it on a plaque, but it fell behind the couch in the staff room and I don't know where it is. And they can't repeat it. They don't remember it because it feels not relevant, but actually it's highly relevant if you do it right. And if you do it right, it forms this ability for people to understand, why are we here? What are we actually trying to do? And it aligns those green arrows versus the gray arrows that are really focused on their own self-interest. They're in the autonomy level. Now, again, we're balancing these, but in the absence of vision, everyone pretty much orients to their own individual purpose and they just play nice around the relationality. But it's not clear, why do I have to give this up to get to another level? So I wanted to give you a little bit of a case study to kind of link this so that it becomes a little more clear. So I worked with a primary care team, very typical setup there, where, the physicians were in their own sort of medical group that was attached to an interprofessional group, but they were sort of, trying to collaborate, but in a way that was highly autonomous, let's say. Okay. So we often see this grouping where it's like the physician group might have their autonomy and they'll say, well, we have our own staff here. We have our own reception or medical office assistants. But, we'll refer to social work on that side because that's good because it kind of slows me down and I don't have the time to do the counseling. So we see that dynamic happen a lot back to the autonomy, right? So this was a group that was very much organized like that. And we came in and did training with them. And what was really interesting is that we put them in a training team, a leadership team that was, it included the clinical managers, it included the head of the medical office assistants, there was a nurse practitioner in the group and the physicians, and they were the leadership team. And through this, we came to a shared vision that was important to the whole group. Where did they want to see the whole team move to? And so what they came up with was making health matter. This was their vision. Now, again, it may sound like, okay, what does that really mean? But underneath it, they talked about the project areas. And the project areas were about improving patient access, centralized check-in, and standardization. These were things that they felt were important projects. But through learning about these tools, they began to think in a way that was collectively. So what would happen before, one of their key pain points that upset every interaction with the physicians was that patients would come in and say, well, it actually upset all the providers, but particularly the patients would complain to the doctors, why can't I get through on your phone line? And I have to blah, blah, blah. And the phone rings and rings and I never gets answered, right? And so patients were really, really frustrated about this. And so this was a central piece for them, a shared pain point, if you will, around improving patient access. And so the physicians would, come out of their every 15-minute meeting and they'd say, I got another complaint, and they might get upset with the MOAs and say, we have to do something about this, blah, blah, blah. But they didn't really have a view back to the complexity into how to solve it. That wasn't their area, but because they're given power in the system and maybe they paid some of these MOAs salaries, it was like, okay, well, you're the boss, you tell me what I should do about it. So there wasn't a resolution. That was, again, kind of a simple approach to something that was actually neither a complicated, it was actually more of a complex problem. And so when they realized that, what they did was they got together. One of the physicians joined in with the lead of the MOAs, and they went to the group and they said, this is our vision, making health matter. We want to improve patient access. And they asked the medical office assistants together, how might we do this? Back to the approach culture, giving them autonomy, but still the relationality in the decision-making, right? This affects all of us. How can we do it? And what did this do? A huge kind of groundswell of like how to solve this problem came up. And it wasn't really that hard for the MOAs to solve the problem. But nobody had really talked about the why. They were waiting in a power structure for some expert to come down who was, perceived to have power in the system to give them a solution, a baked solution. Well, it kept not happening. They got together and they said, okay, these are our high volume times. This is when people are calling in. What we're going to do is take people off of labs and off of whatever, and they're going to come, they're going to answer the phone bank, and then we're going to switch later. We're going to help them. We're going to cross train. This is how we're going to do it. 10 days, done. Problem that they'd had for 10 years went away. And the patients started coming in and saying to all of the providers, I don't know what you guys did, but I can get through on the phone. They were elated. They were thrilled. Very simple kind of solution, but you can see how you think about it matters a great deal. And so they got into that growth mindset culture in a way that actually allowed much better collaboration. The physicians saw actually, oh, wait a minute, back to the agency, things actually do get done. And I don't have to be the one driving it. And they kind of sat back and they were like, oh, let's delegate this more. Let's think about how we work better together. Back to the safe to fail experiment, right? And so that really shifted the tide in the whole organization about how they worked collaboratively and how they handled balancing trust and power and agency. So those are the steps that we just talked about. So let's see. I wanted to invite you to think about for today, and we're going to go into questions, but I wanted to invite you to just reflect a little bit because I gave you a lot of content here. But what's really important is that you do something different as a result, right? That there's some kind of action follow-up. So here, there are some tools that we talked about. We talked about the choosing your focus, connected to vision, or thinking about sort of the amygdala and the role of that and how you can dampen down that threat response. And so thinking about what of these tools maybe struck you, or what's a way maybe that you can, for example, with Choose Your Focus, think about describing the problem from the vision level. Or was there something from TAP that you thought, if I go back and talk to my team about it in this way, let's balance these needs? Of course, because I've presented to you about vision, I think being able to speak to the vision is a really powerful one, and thinking about how we do that in a way that's resonant for everyone is super important. And so consider for a minute how you can connect to your purpose and vision, because yes, it's shared, but the truth is that when we work together for the benefit of the people who seek care in the system, there is a felt alignment around why we're there. But your ability to connect to your own sense of purpose can be really powerful in igniting it in others. In fact, the research shows that when we are aligned to that sense of purpose, it breaks down in-group, out-group barriers. And what's also fascinating is that when we view somebody as an enemy, so we say in some way, even in terms of, this is part of the difficulty we have in interprofessional work, we have an identity inside of our profession as well. And so we view sometimes people from other professions as out-group. And the research shows that we actually process what people are saying to us with different circuits when we've decided they're part of our in-group versus our out-group. So we actually think about it with different circuits in the brain. So this is why the vision is an important piece in terms of getting us all on the same page about we're in this together and what we're trying to achieve together in a way that kind of will reduce the effect somewhat of those differences, how we align in terms of particular groups. Okay, so take a moment and just reflect and say, well, what can I do differently as a result of this that might be helpful in my team, that might be helpful as we work to become sort of more of an interprofessional aligned group. And once again, if anybody wants to share that, it'd be great. We can talk about it in the Q&A in a minute. So as we conclude today, I just wanted to let you know that we do have our Evolution of Thinking program. If you want to delve deeper into this, it's an intensive program, brain-based. It's why, again, it involves, we go from September to December, and there's coaching as part of it to help you develop new habits. And so we have a lot of great, you'll see in the paper, we have a lot of great outcome data on the impact and how it's influenced teams to be way more high performing in terms of their alignment to vision, in terms of the psychological safety that gets created. So if you're interested, and you can certainly put your name in the chat if you want more information. We have tons of resources on our website, free resources if you just want to dabble in that. Many videos, there's blogs where we go into really, for us, it's really important to have pragmatic strategies for you. Things like Choose Your Focus, things like tools that you can implement right away. Okay, so that's the deal with the www.instinctsatwork.com if you want to visit us there. And I'm always happy to have consultation with any of you if you're stuck on something and you want to think about how to apply this. Okay, so let's take some time now for opening it up for some questions or whatever. If you want to go into that, I'd be more than happy to discuss that with you. Thanks for the clap, Ivy.
Yeah, while everybody's formulating a question, I just want everybody to know, Penny's working with us as a leadership team. And if you have any kind of reticence, and it's like, oh, what is this all about? Do we really need to do this? I've been doing this for blah, 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 blah. It's amazing. It's amazing what you can learn from this. And so I just really want to encourage everybody to have a really open mind about how this can really accelerate, accentuate, especially, we're doing work that's like so time constrained. And if you're working in a context of a team where you're working in a resource constrained environment, it's easy to say, I don't have time for this. Take the time. It really does help. So I just wanted to give kudos. And so thanks so much, Penny.
Thank you.
Thank you, Penny. Maybe one thing, you mentioned the amygdala wash. Maybe just describe a little bit more detail what that means, because that's a great tool.
Oh yeah, that, you know what, honestly, I realized that was from another slide deck. I didn't get into it because I didn't think I'd have time, but now I have time, so that's great. So the amygdala wash is based on research by Matthew Lieberman and Naomi Eisenberg. So back to, remember we talked about the amygdala and kind of the red zone there where we're experiencing a lot of threats. So we may not even be that aware, but you know, for example, we can experience a threat where, let's say you came out of a meeting and somebody was gruff in the meeting, and it could have had something to do with something else that happened just prior, but you're sitting there going, are they mad at me? Was it something about, no, like what's happening here? You know, that process is basically your amygdala is going, is there a threat here? Is there something I need to attend to, right? So small, even these micro kind of moments that we are scanning for safety. And so what Lieberman and Eisenberger discovered is that just labeling the emotion can be helpful rather than going into the narrative. There's actually really interesting work by Norm Farb at U of T about these different networks, the sensing network and the narrative network, different networks in our brain. And so I'm gonna invite you to an actual exercise here. So if we want to move into the sensing network, we're going to connect more into our physical body, our physical sensations. So I want you to take a moment and just take a breath in. If you feel comfortable, you can close your eyes. You don't need to. Take a breath in and out and just pay attention to the sensation of your hands. You can clasp your hands. I want you to experience what it's like to tip into that sensing network. So you're just paying attention to the feeling of the skin of your hands. Does it feel rough? Does it feel smooth? Are your hands cool? What are the sensations? Taking a breath in and out. You may notice that things pop into your mind from the narrative network. Oh, I don't have time for this, and I have to do this before my next meeting, and blah, 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 whatever is going on in there. It's fine. Don't worry about it. Just notice it. But label any emotion that might be there, whether it's some anxiety or frustration. Those tend to be common ones. I often notice if I'm excited about something, I find that very distracting. So there might be excitement. It can be positive emotion. It doesn't really matter. Just label the emotion. Don't go into the story about why. Back to the details and problem. We just want to label it. And just say to yourself, I'm going to move that emotion to the side. I'm going to move that to the side to practice coming back to my sensing network, to being here and present. And take another breath in and out. And focus back on the sensation. Maybe rubbing your fingertips together, noticing what that feels like. Just grounding through the body and sensing. And enjoy another breath. And when you're ready, you can just come on back to the Zoom room. So if anyone would like to share, I don't know, how was that for you, or what did you notice from that?
Hi, Penny. First of all, I'd like to thank you. The presentation is amazing. Breakdown of information, absolutely beautiful. What I noticed is my sense and touch were a little bit more heightened. At first, you had like thoughts sort of going in and out, but the second experience, my eyes are still closed, the breathing was happening, but I could feel the touch a lot more.
Amazing.
Yeah.
Thank you for sharing. And I want to say also thank you for your very expressive face. It helps a lot when you're presenting to have somebody that it's like, you know, giving you that feedback. So I really appreciate that. At least it was expressive in a positive way. You weren't going, anyway, I appreciated that. So was there a change in terms of what you noticed in your thinking through that process, or anything else as we went through that exercise? Did you notice anything else in terms of how you were thinking, or how quickly your thoughts were running, or anything like that?
Is it back to me?
Yeah.
Okay, well, the first time we're talking about this evolution thing, and my mind is so excited. I can't wait to go in and dive in on deeper information about this session. But anyways, and the second time, I recognized my breathing was a little bit more shallower and more relaxed, sort of, taking that excitement out of the picture. So it was really interesting. And within a matter of seconds and minutes, so really impressed.
Yeah, amazing. So we train leaders to do this, even if you're running between Zoom meetings, and the reason is, think about it, if you're in the narrative, and this is really, really important, we just finished a reunion call for people who were in our last cohort of evolution of thinking. Let me tell you, when we started the program, they're all like, we do not have time for this. That's what I always hear. We do not have time for this. We cannot possibly fit this in. Way too overwhelmed. At the reunion call, they said to us, we are more focused. We are more clear on priorities. We are less stressed. We have more of a sense of achievement and accomplishment. We were kind of joking about it, saying, wow, you actually put some boundaries around your work. You started actually leaving earlier, and it's like, oh, and did your whole organization fall apart? It's like, it's back to the reactive thinking. So we are being pulled into that frenetic kind of way of thinking about things, but it actually doesn't serve us for our best thinking. So practicing tools like this enables better decision-making, more clarity, and most importantly, and I think this is critical in the work we do, it allows you to move into that parasympathetic nervous system kind of response, slow things down in a way that you don't burn out. And we need more effective leaders to be staying in the game. It's really critical. So it's back to the upskilling. It's not about fixing the world out there. It's fixing the internal. And these are proven strategies. You can do it, and you will be clear. You will be more focused. You'll be clear about the priorities, and people just feel a lot more satisfied and relaxed with that. And so that's really my hope for all of you, because you're doing such excellent, critical, like this is critical work. Critical as we feel the whole, threat of privatization at different levels. If we want to preserve our health system to be free and equitable and accessible, we have to work at these levels. But it's not just working harder the way we thought about things. We actually have to shift how we're thinking about things to preserve that. And that's something I'm deeply committed to. So I'll end on that. My vision around that. But
Thank you so much, Penny. Many great insights for all of us to think about, and so much information. And having worked with Penny, believe you me, it does take a while to kind of grasp the various different concepts. And so that paper is available on the link that we sent out as a reminder for this webinar just this morning. But if not, please contact us and we will send you the paper. If you want, I'll send the emails that you dropped into the chat to Penny, and you can certainly sign up. There's lots of great free materials on our website and lots of opportunities there. So kudos and many thanks, Penny.
My pleasure. Thank you all for taking out the time. I know how busy you all are, so I just think you're inspiring. And keep the faith in terms of what you're trying to do. And there is a way. So yeah, one thing at a time.
Absolutely.
Thank you.
Thank you so much. Bye.
Bye.
Thanks all.